Good afternoon.
Thank you, Chair.
It's,
anytime when you are ready, Chairperson, you can take over.
All right, yeah, it's 9 o'clock already. Thanks. Honorable members, we, on our second session, the discussion remains, the topic remains the same. These are the topics that we invited for to be in this meeting, expenditure and the budget expenditure on these two programs. Yeah, what we want to check is, are the monies used for what they were intended for? Are we really getting money for our value for our money? Why is there less expenditure on this important budget? And the rest, you are all welcome. And I'll give over. Who's making the first presentation, Oltandra?
It's the Northern Cape, Chair.
The Noor Delegate Cup. Welcome. Is the MEC in the meeting?
Yes, Chair, I'm in the meeting.
Oh, yeah, no, thanks, MEC, for being in this meeting. We really appreciate that. Other provinces couldn't make it, and the fact that you are here shows that you really take us seriously, and that the interventions that we're making in this, you see that, you know, they could help in making change in your province. Thank you, and you're welcome. You can give the presentation.
Thank you, Chair. Apologies for only joining now the meeting, Chair. I was just attending a social cluster meeting convened by the Premier's office, but now I'm back. The presentation will be presented by the HOD with your permission, Chair.
Yes, HOD, over to you.
Thank you, Chair.
Thank you so much, MEC. Thank you, Honorable Chairperson, and good afternoon to all the members. We are on the slide. We can go to the next slide, Chair. I'm going to try and do as quickly in terms of the time allocation so that we gain a bit of time for discussion. On the introduction, we are first reporting on the HIV and AIDS grant, conditional grant, Honorable Chairperson. The Department of Basic Education and Treasury informed all provincial departments of a significant budget reduction in terms of the initial grant that was allocated to us. And the Northern Cape was also similarly affected, in the sense that our conditional grant was reduced from 5.849 million to 4.436 million, realizing a budget cut of 1.413 million in the 2020-21 financial year. Due to these budget cuts, honorable members, we then had to discuss what are we going to do and how are we going to reduce on certain of the KPIs. And then what we did is we didn't entirely suspend the KPIs, but then we reduced and suspended some activities under advocacy and social mobilization, under peer education, under learning and teaching support, and then also under monitoring and support. If we go to the next slide, we'll see that under training and development, the budget was allocated then 2.525 million, and we managed to spend all of that. Under KPA 4, which is care and support, we allocated 1.766, and we managed to also spend that. And then on KPA 7 and 8, under management and administration, we had 145,000, and we've also managed to spend all of that. So in total, on the HIV and AIDS grant, Chairperson, we've managed to spend all of the money that was allocated to us. If we can go to the next slide, then just giving a bit more of a breakdown in terms of what were the targets that we set, and where did we reduce some of the achievements in terms of the COVID-19 conditions that we had faced with, which we were also affected by. And then also, what did we do to try and reach out more in terms of the other areas? So as you can see, honorable members, in terms of advocacy, we couldn't reach all the learners that we have targeted because the learners were not at school. But then what we did with the help of our learner support agents, we tried to reach more from the in terms of the other sectors where we also had to do advocacy. And then we made use of our learner support agents to reach out. I'll say a little bit more about that as well, because we had some face-to-face contact by the learner support agents, but we also used other modus of operandi to reach the educators and members in the community. So you will see we then, in terms of educators, instead of the 250, we managed to reach 2,170. And then in terms of community members, we managed to reach 623 community members, and we managed to reach out to 336 schools through the participation of our learner support agents. What we then also did is these learner support agents were appointed from the prior year. So we were then able to reach more people. In the training and development, we managed to reach 60 educators. Our target, was 60 educators. We managed to reach 78, and we also managed to increase our reach to 1,282 learners under training and development. Under peer education, we managed to appoint 40 learner support agents, and then we managed to reach 2,497 learners. By this time, Honorable Chair, our learner support agents have decided to start using other platforms like the WhatsApp platforms and try to find out which of the learners were actually making use of these platforms, and they then changed their reach in terms of the programs and in terms of the advocacy, and started using other platforms to try and reach the learners in the various areas where they find themselves. So in the Northern Cape, a lot of what we've managed to achieve, we managed to achieve through the appointment of these learner support agents. And we therefore also want to recommend going forward that these people be capacitated even more, because they have proven to be quite invaluable in the manner in which we then rolled out training as well as advocacy in particular. Under care and support, we had, the target was to have 9 learner support agents. We managed to reach that target. And then we managed to reach 14,325 learners over and above what we have initially set through various different mechanisms of social media interaction. Then on LTSM, we targeted 50 schools. Through the savings that we have then realized in terms of what I will later explain, Chair, where we adopted different mechanisms. What we also did was where we found that there was underspending, we then agreed that we would procure additional LTSM, and therefore 94 schools were provided with LTSM. We also decided to reduce the number of sets delivered to schools so that we could reach further, and also in this process then managed to reach more schools. The 1,600 sets of policy packs and the 1,072 that were delivered was also not delivered, or some of the sets were not delivered due to the lockdown conditions that were then already in place, and these additional sets, or what is left, will still be distributed now during this period. In as far as monitoring and evaluation is concerned, here you can see, Honorable Chair and members, that although we initially targeted 50 schools, we couldn't get all of those 50 schools. And that was also because of the lockdown. The schools were closed, and so we could not really get to those schools. Then on the Lspid grant, if we can go to the next slide, our allocation cumulatively and the transfers in terms of the total budget, which was 13.760. The transfers are indicated there, and then by the end of the quarter four, all the money has been transferred to us. And you will see that we have spent in the first quarter 3.596. There was a variance of 10,164, and then at the end of quarter two, we've spent 5,130,000, and there was a variance of 8.630. And then at the end of quarter three, we spent 54% of what our allocation was. By the end of quarter four, there was a variance of 209,000, by which time we have then spent 98% of what was allocated to us under the specific grant. The recorded underspending of 209,000 is mainly due to undercompensation of employees. In the Northern Cape, I think it was mentioned by our colleagues from DBE also yesterday at the beginning, where we really, Honorable Chair, have difficulty in attracting and retaining these specialists. And then we will see what we need to do in order to be able to attract these specialists. We might even have to go on a process of headhunting supported by our colleagues at the national level. We can go on to the next slide. So on output one, you will see that we had 10 posts, and then 8 of these 10 posts were filled, which accounts for the 2 that we said we were not able to fill. There were 2 vacancies, 1 educational psychologist and 1 chief education therapist, to be filled in the transversal itinerant outreach team. And these posts are based in our ZF Ngawu Education District. In terms of the number of care centers, I will ask if there's questions around that. We will answer questions with regards to the number of care centers that we were able to take on board. Although we targeted 16, we were only able to have on board the 8 centers. And we know also because of the lockdown, before we could really do the onboarding of the others, of the other 8, then the centers were closed due to COVID. The same explanation in terms of what the number was that we targeted for the number of caregivers. We managed to reach 31 by the time lockdown happened. The number of learners in these care centers, we could only reach 180. Some of these learners remained at home. And then the number of learners in the learning program in these care centers, there were a number of learners, 34, who could not be assessed. So they participated in the learning program, but we couldn't complete the learning program because these learners, we were not able to assess them and complete the assessment process. And then the number of learners in the learning program in schools, we did not have any targets in this regard, because schools only selected for onboarding in this particular financial year of 2022. And then in terms of output number 3 on the next slide, we have to speak to the transversal itinerant outreach teams, the teachers, the caregivers, the in-service therapists and officials trained on the learning program for this particular grant and the targets that have been set. And then the target group, the first target group was the transversal itinerant outreach team members. Here we had targeted 10, and we managed to do 8. And the reason for the variance was the 2 vacancies that I already spoke to. And then also there was the topic that was regarding the installation of the eye tracker system. And then the training, of course, was part of the training that happens before device procurement. In as far as caregivers are concerned, we had training a target of 55, and then we managed to do 80 also because of our implementation of the lesson plan for Q4, which we managed to do up to the generation of report cards for learners. We have been using the learning program, and also there was training in terms of how to utilize PPEs. And of course, there we managed to reach more caregivers because by that time our focus slightly shifted, and we were more able to reach the caregivers and the teachers, as we can see on the next line. Also, teachers from special schools, we targeted 35. And then we managed to reach 80. Here also, we upped our target, not just because we could reach more teachers during this time, but also because the schools had a special request that all the educators at these centers should participate. Unfortunately, with regards to the officials, we had a target of 40, but because of that particular number, being only 14, we wanted to take them all through the training at one specific time. We couldn't do that due to the lockdown restrictions, and this training is scheduled to happen for this particular financial year. On output 4, outreach services provided to children and learners with severe to profound intellectual disabilities. On the next slide, please. We have the outreach activity of cognitive assessment of learners enrolled in the learning program. Our target was 229. Unfortunately, we could only reach 53 of these learners because our educational psychologists could not reach all learners due to the COVID regulations, and also whilst learners remained at home during the closure of the care centers. The participation, how many participated actually in the learning program? 79 out of the 113 that we targeted, and again here learners who remained at home we could not include in the data for assessment. Learners having access to therapeutic and psychosocial support. We had a target of 100. Our therapists could not reach the learners because they have refrained from direct contact with learners in order to avoid the spread of COVID-19. Learners from care centers placed in schools. We had a target of 20, of which we reached 1. And the placement facilitation process again was hampered because we could not complete the cognitive assessments. The LTSM classroom and furniture equipment, which we wanted to procure for the 16 centers, we managed to procure for the 8 centers because the other ones have not been fully could not be onboarded because of the closure from March 2020 until February 2021. The provision of shipping storage containers operations at one of the care centers ceased, so we could only reach 4 out of the 5 to be targeted. Also on the issue of provision of assistive devices, we targeted 40 assistive devices, honorable members. But then again, we do this in collaboration with the Department of Health. So there is a waiting list at the department compiles with the assistance of the Department of Health. and we were not able to procure those assistive devices, and these devices therefore have to be procured in the current allocation, together with a new target that would be set for the numbers for this year. Under output number 5, this is also where we redirected some of our resources in order to assist the centers to respond to COVID-19. Personal protective equipment was bought for learners and for caregivers as outlined there, and for support staff as well as team members. Then thermometers and consumables. 14 care centers were provided with these thermometers in order to become COVID-19 compliant. And then also we have managed to secure technology to begin the process of remote learning and access to therapy. So 20 laptops were procured. This is some of the procurement we did in advance, honorable members, in order to be able to distribute to the care centers. So 20 laptops were procured, and 55 tablets were also procured for the caregivers, which is in the process of being allocated for this financial year. The challenges that we experienced and the proposed intervention or the risks, we are all aware of the fact that the special care centers remained closed from March 2020 until February 2021. And then one of the difficulties we had is that we could not really pronounce on the closure and reopening of these special care centers, which then has resulted in delays to execute some of the planned activity of the grant business plan to the fullest, and in order to ensure that we actually expend as we have planned, and therefore we had to apply for deviation in terms of the resources and how it was originally allocated. Some of the interventions that we then did, we redesigned the training, teaching and learning, as well as therapeutic services from conventional to remote modalities using the relevant technology which has been procured. One of the other challenges we experienced was the supplier of goods in particular experienced delays due to the requisition items, which was on the time, and for on-time delivery during hard lockdown, there were delivery delays. This, of course, then comes to the risk that there's been delayed payments for delayed delivery on purchase orders, which then has resulted in accruals or warranting rollover requests. And then also we had to use some of the funding to then pay outstanding accruals. One of the things that we've considered, because we're a smaller province, honorable members, is that if it's possible for us to participate in transversal tenders, that is a possibility that we are actually going to look at in order to save on time and on cost. Because if we participate in a transversal tender, then it means we might also be able to benefit from cost efficiencies because of bigger numbers, and we are part of that. The challenges we have experienced regarding recruitment and retention of the specialized human resources in the vacancies as outlined seems to remain an inherent challenge, which prevents us to fill vacancies in the manner that we would like to. And then, of course, that in turn results in the underspending on compensation of employees, as we have indicated. And what we will do with the help of our national department is to see to the extent to which they can assist us to procure these scarce skills which we're having difficulty to find in our own province. Honorable Chair and members, I will stop there. That's the end of our presentation. Thank you very much.
You're welcome. Thank you. Is there anyone who wants to make addition to this? If not, so let's move to the next presentation. Thank you.
Thank you, Honorable Chair. Good afternoon to honorable members, honorable MECs, heads of department, and all the officials present in this meeting. My name is Stefina Mamuto Semaswe. I'm the head of the Department for Education in the Northwest Province. The MEC is not in this meeting. Her apology was presented earlier this morning in the meeting. So I'm going to be making this presentation. I'm not alone. I've got a team of managers. The program managers are here, and the acting DDG is here, who are supposed to present, but she's not feeling well. The presentation outline, Honorable Chair, is as it is on the screen. We'll be presenting firstly the life skills, HIV and AIDS, and after that, the Lspid grant. Chair, on the issue of the life skills, HIV and AIDS program, the first slide there indicates the expenditure per quarter for the financial year 2020-2021. The first quarter, the budget allocation was 16.7, and we had spent by the end of the first quarter 16.1, which was 3.6% of our budget allocation. However, Chair, there were budget cuts that were done. Northwest was not an exception. We did experience the budget cut in this grant. And therefore, our budget was cut from 16.7 to 12.7 million. By the end of the second quarter, out of the 12.7 million, we had spent now 1.8 million, which together with the first quarter made 14.4%. And at the end of the third quarter, Chair, we had spent 8 million, and it constituted about 65.2%. And the fourth quarter, Chair, sorry for the typo error there, it's supposed to be 31 March 2021, not January. By the end of the fourth term, Chair, the budget allocation total for the entire financial year remained 12.7, and we had spent by then 12.723, which makes 99.9 of the allocated funds. That was the expenditure for 2020-21 financial year. On this slide, Chair, we are indicating the repurposed budget allocation, which is due to the budget cuts, as I have already said. So you realize that, as I've said, our budget was cut from 16.79 to 12.7. So the slide simply indicates, as per key outputs there, how much was allocated during the initial budget allocation and how much remained after the revised budget allocation. Advocacy, initially we had 3.3 million, and after the budget cut, it went down to 2.5 million. Training and development, 1.6, and it went down to 1.27. Co-curricular activities, 3.3 initially and went down to 2.5. Care and support, it was 4.1 and it went down to 3.1. LTSM 1.6 and it went down to 1.2. Monitoring and support, it was 1.1 and it went down to 891,380. And the remaining was for administration, which went down to 1.01 million. And those percentages were divided in accordance with the grant framework. So we just wanted to indicate how the budget cuts affected us. And in this slide, Honorable Chair, we speak into performance information on the HIV and AIDS Life Skills Grant for the financial year 2020 and 2021. The level of spending in this grant for this financial year was, as I've already said, at 99.9, and the conditional grant performance was at its maximum performance despite the lockdown challenges for Q1 and Q2, as maybe you have seen from the expenditure. And then we have not requested any rollover from the financial year 2020-21 because we were at our optimum. The grant expenditure was elevated by the appointment of additional 90 learner support agents, as in addition to the 70 learner support agents that were previously appointed. And these learner support agents are paid 3,500 stipend per month. And the learner support agents are assisting us in the implementation of the program at the level of the school, and this also, Chair, also assisted in terms of availing job opportunities for the unemployed youth in our province. Now, the next slide will speak to the achievements in terms of the this program. We had, at the end of the financial year, we had trained 100 educators on how to respond to sexual and gender-based violence, and 499 primary school educators were capacitated on how to establish and facilitate soul bodies peer structures, and 317 secondary schools are implementing now the peer education program. And we have, from the 317 secondary schools, 7,925 learners that are participating in these sessions, and these topics are the ones that they are participating on. The topics being building self-esteem, values and relationship, building the healthy relationship through assertiveness group sessions, and also learners used the MTV Sugar episodes on sexual reproductive health. And also, again, 366 primary schools implement peer education program. And out of these 366 primary schools, 9,150 soul bodies participated in the sessions that encourage health promotion, a just society, and respect for basic human rights for children. In the next slide is the continuation of the achievements, Chairperson, where 28,726 learners were reached through awareness campaigns. And these awareness campaigns were dealing with teenage pregnancy campaigns, substance and drug abuse campaign, TB and COVID-19 awareness campaign. And also, again, we networked with the stakeholders to support vulnerable learners with basic needs such as food uniform, sanitary towels, and 10,012 learners also benefited from the material support. 81,722 age-appropriate LTSM material was printed and distributed to the schools, and 10,000 copies of standard operating procedures for the provision of sexual and reproductive health rights and social services were printed and distributed for advocacy sessions with schools and parents. In the next slide, Chairperson, is a summary of HIV and AIDS conditional grant expenditure as at 31st of March 2021. This is just but a summary. You'll realize that in terms of the key outputs there, only for training and development, we have spent 75%, which is the lowest expenditure in terms of this grant. The reason here is that during the lockdown, we could not do face-to-face training, and then the learner support agents and other people in our care centers were not yet being trained on how to do training through a virtual training using MS Teams and other platforms. So hence we had spent only 95%, but all other key outputs performed very well, as is reflected on this slide. As I move on to the next slide, which speaks to the challenges and intervention strategies to address the under expenditure that you have seen, especially on those training and development. Due to COVID-19 level 5 regulations, all our activities were placed on hold as they required face-to-face. I've already spoken to this one. The Life Skills HIV and AIDS program is part of the COVID-19 provincial task team, and the following activities took precedence in ensuring that schools are able to contain the spread of the virus. The programs or the activities are support to schools to manage COVID-19 cases. The team also gave psychosocial support for learners in our schools, and they also did orientation on the standard operation procedures for the containment and management of COVID-19 for our schools. Training and development for educators is conducted on weekends to protect the academic catch-up programs. So these are the intervention mechanisms that we have put in place. And the beneficiaries who are the learners, the activities contact time is after school or also on weekends. Now, we do have stakeholders that are assisting in the reach of learners, and the stakeholders are Community Media Trust, Networking with HIV and AIDS Community of Southern Africa, NACOSA, Soul City Institute, and also working together with Doctors Without Borders. And with the assistance of stakeholders and departmental partners, sexual reproductive services will be initiated in schools commencing in this financial year. The department is also in collaboration with government departments to provide care and support to vulnerable learners. Programs such as Integrated School Health Program are used to provide integrated services to the learners. And the next slide will speak to HIV and AIDS Q1 performance for 2021-2022 financial year. In this slide, you can see that in terms of the increased HIV, STI, and TB knowledge and skills amongst learners, educators, and officials, we had targeted about 500, and to date, 167 teachers were capacitated on the response to sexual gender-based violence. And also, again, in terms of advocacy for the key pillars of the HIV and AIDS life skill education program, including creating awareness and sharing information about the new DBE national policy on HIV, STIs, and TB. We had targeted about 200, and to date, 970 SMTs were capacitated on care and support program, including a sanitary dignity program. Also, in terms of Q1 2021-2022 financial year, we were targeting 17,075 learners in terms of their participation in peer education programs, including keeping girls in schools and boys mentoring programs. To date, in terms of the target that we have put, we have 375 learners being reached through MTV Sugar Peer Education Program, and 3,636 learners were reached through the KGIS material sessions, and 9,150 primary school learners are reached through the Soul Buddies peer education activities. And also, again, we had targeted 25,000 learners or beneficiaries in terms of awareness campaign for teenage pregnancy, TB, and HIV prevention, including their risk factor, tobacco, alcohol, and drug and substance use prevention. Of this 25,000, we have already reached 16,532 learners through advocacy and awareness. The Q1 performance continues. We have to date appointed the learner support agent. We had targeted 160 and we have appointed 160. Learners reached through psychosocial support. 7,839 learners are reached through group debriefing sessions and 99 learners reached through one-on-one counseling sessions. And learners reached through social welfare services. 1,021 learners reached through referral to specialized services such as Home Affairs in order to get their identity documents and are able to access the services rendered by social development. And learners reached through material support. 16,776 learners were provided with school uniform through networking and support from the stakeholders. And in the next slide, Honorable Chair, is the summary for HIV and AIDS conditional grant expenditure as at 20 June 2021. In terms of the summary there, as you can see, these are now in amounts. For advocacy, we had the allocated budget of 2.3 and the expenditure for Q1 now is 583 and 803,000. And this is about a 25% expenditure of the allocated budget, whereas for advocacy, we are at about 30% of the allocated budget. And for co-curricular activities, we are at 22% of the allocated budget, and CAN support, we are now at 26% of the allocated budget. Whereas in terms of LTSM, procurement is still underway, and monitoring and support, we have not yet recorded expenditure, though monitoring and support is continuing taking place. For administration, we have 12% of the expenditure to date in terms of the 2021-2022 Term 1 allocated budget. Chairperson, allow me now to go to learners with profound intellectual disabilities. The first slide in this presentation for this grant will be the expenditure per quarter for the financial year 2020-2021. Q1, in this grant, Chairperson, we did not have any budget cuts, but we did have some repurposing within the allocated budget for us to be able to meet the demands of PPE provisioning as far as our centers are concerned and the personnel that are working in our centers. For Q1, we had an allocation of 18.4 million. I mean, the total allocation is 18.4 million. And at the end of Q1, we had spent 2.9 million, which is 16.0% of the allocated budget. And for Q2, at the end of Q2, we had spent 5.645 million, which made 30.66% of the allocated budget. And for Q3, we spent 9.451 million, which made 51.33% of the allocated budget. And at the end of the Q4, we had spent 15.6 million, and the total expenditure for at the end of the Q4 was 84%. In terms of repurposing, as I've said, we had repurposed some funds within the allocated funds themselves. There was no budget cut here to accommodate provisioning of COVID-19 PPEs. When you look at the outcome 1, human resources specific to inclusive education, the initial percentage that we had allocated was 65%, but then the revised percentage was 56.3%. And for database of selected schools and care centers, initially we allocated 12%, and it was cut down to, repurposed to 6.6%. And then for outcome 3, we had allocated 5% and we repurposed to 2.8%. Outreach services, 18%, and it remained as such. And for COVID-19 PPEs, there was no allocation, but after repurposing other funds from other activities, we then allocated 16.3% of the budget, which is 18.414 million. Now we go to the next item, which speaks to Q1, 2021-2022 performance. In terms of Q1, learners with profound and intellectual disabilities grant, we had targeted about 300 learners for Q1 in terms of care and support, but then the output is 429. And the reason for this deviation was that the care centers are privately owned and are run as businesses for the owners. Therefore, the more the learners they admit, the more money they make. Only owners have control over the admission of these learners. But for our target, it was 300 and it went down to 429. And in terms of the second indicator, number of caregivers and special schools teachers trained to provide care and education for learners with severe to profound intellectual disability. We had targeted 100 for Q1, but we managed at this point in time to reach 64 caregivers and teachers in special schools. The reason for this deviation is that the number of caregivers in care centers has dropped drastically due to COVID-19, and that not all the care centers were open at that time. And the remedial work that we are doing here is that we are training teachers. The training of teachers is planned for the second quarter, and we are encouraging all care centers to open in conjunction with the Department of Social Development. And in this slide, we are talking to the number of care centers which are functional and those that are non-functional. Most of our care centers, did not open due to hesitancy and the fear of, being infected by COVID-19. For Bojana District, the care centers that are operational at the moment are 11, and we don't have any care center which is not operational there, and all the care centers are 11. In Dr. Kenneth Kaunda, we've got 11 care centers, but only 6 of the care centers are operational, whereas in Dr. Ruth Sohomutsi Mumpati, we have a total of 5 care centers, and all 5 care centers are operational as we speak. In Ngakamudiri Mulema, we have a total of about 6 care centers, and only 3 of the 6 are operational. And the total care centers that we have are 32, and of the 32 care centers, 24 are operational and 8 are non-operational. Performance information on the Lspid grant. The level of spending for the financial year 2020-2021 was at 84%. And the service providers could not be paid on time due to the delay in the delivery of the consignments, which resulted into invoice being submitted after the cutoff date of payment. As a result of that, we had requested a rollover amounting to 1.2 million and for the payment of the assistive devices, mobile storage containers, and the toolkits and LTSM. I've already indicated that some of the care centers did not function optimally for almost the whole of the financial year. Nonetheless, procurement and training was facilitated as per business plan. PPEs, LTSM, and assistive devices were procured and the new care centers were uploaded, and the money for those care centers was redirected to the new care centers. And the next slide speaks to the summary, maybe just to indicate the total summary. In the Northwest Province, we have about 32 care centers, 121 caregivers, 499 learners. And then 22 of the 121 caregivers were trained on revised learning program, Term 2 lesson plan activities and assessment to improve strategies to improve lip closure and sensory awareness and decrease drooling. 92 learners received therapeutic services, and the therapeutic services that the learners received were on speech and language therapy, occupational therapy, and physiotherapy. The achievement in terms of Lspid, 13 of the grant staff appointed, 13 of the 16 grant staff are appointed on permanent basis. And the remaining 3, which could not be appointed, were as a result that they declined the offer for appointment, and then the department is now have considered appointing the second best candidate so that we fill up the spaces. And all outreach teams are based at the districts, and we have developed a database of 32 care centers and they are being managed through SASEMs. We have successfully implemented the learning program in the 32 care centers and in the 4 targeted special schools. We have procured assistive devices for 45 learners who were identified with profound intellectual disabilities, and we have also procured LTSM for the care centers and targeted schools. Training on the learning program was conducted to 11 outreach members, 122 caregivers, 95 teachers, 4 therapists, and 68 officials. And the next slide will speak to the challenges and intervention strategies to address the under expenditure on the Lspid grant. The low spending was due to the 13 therapists being appointed instead of 6 as per business plan. And as I've already pointed out, the appointment of the 3 staff members, the remaining 3 staff members is being considered, and we are taking second best candidates from the procurement, from the selection and recruitment process that has already unfolded. Invoices amounting to 1.2 million could not be paid on time as service providers had to procure the goods from abroad, and due to the lockdown, there were backlog in the manufacturing of goods, which led to the delay in the delivery of those goods. And then the other reason is that the training of caregivers was also a challenge, as the training could not be provided virtually due to lack of resources. Moreover, the caregivers training is hands-on and it has to be modeled. Care centers were not operating optimally as some were closed permanently after the lockdown. Nevertheless, procurement and training was facilitated as per business plan. PPEs, LTSM, and assistive devices were procured, and the new care centers were uploaded, and the money for those care centers was redirected to the new care centers. The intervention strategies, I have spoken to the appointment of the candidates, and in order to overcome the issue of late procurement of goods and services, even during this lockdown period, we will be facilitating the procurement processes as early as the first quarter for every financial year. And then to conduct computer training for caregivers, which will ensure that they are computer literate, as this will assist in conducting virtual trainings when face-to-face trainings are not possible. In assisting care centers to function optimally, outreach team members intervene on behalf of care centers by encouraging parents who have withdrawn their kids from attending in care centers to bring them back. The outreach team members also assist in alleviating the fears of parents in as far as COVID-19 is concerned. And the last slide, Chair, will speak to a summary of the expenditure for Q1. In terms of this grant, for 2021-2022 financial year, at the end of Q1 for compensation of employees, we had spent 14%. Remember, I've said there are 3 officials that were supposed to be appointed, but they declined the offer. Under administration, we had spent by the end of Q1 11%. We hope to improve on this spending. LTSM, we have spent 12% to date, and training and development, we have not yet recorded any expenditure. However, training is taking place as was indicated in the previous slides. And for COVID-19, we have not yet registered any expenditure. The tender is out on procurement of COVID-19 PPEs, and will be registering expenditure in the next quarter. And the total expenditure for the first quarter, 2021-2022, now stands at 11.5%. Chairperson, this brings me to the end of my presentation. Thank you very much.
Thank you. Is there any addition, anyone who wants to add from the province? In the absence of any, do we take how many presentations are we left with? Is the Western Cape or is only the Western Cape?
Chairperson, the last presentation we are left with now is Western Cape, but unfortunately it has not been submitted to us thus far.
Okay, so which means we are at the end of our presentations.
I've just accepted a colleague from the Western Cape Chairperson. I do not know whether the colleague wishes to clarify this matter, so that we don't just assume that we are at the end and then they come and say, no, we're supposed to present 45 minutes from now, something like that, Chairperson. Yeah, okay, let's hear from them. But the ideal situation is that you don't make a presentation now and want people to engage with it. It's terribly unfair, and it actually makes playing oversight very difficult. But let's hear from the Western Cape, what do they have to say? If there's anyone on the platform from Western Cape.
May I speak? It's Debbie Schaefer, the MEC.
But come again?
It's the MEC speaking, Debbie Schaefer. Good afternoon.
Oh, thank you, MEC. Thank you.
Hi,
Thanks a lot.
All right, thank you. We have got Ms. Berenice Daniels on. She's been on since yesterday. She has prepared a presentation. I'm sorry if it hasn't been submitted to you. I'm not sure why, but I would like to ask her for the opportunity that she can do the presentation to you and then submit it afterwards. I presume she will be sharing her screen if that's in order. I apologize if it hadn't been sent as requested.
No, we're happy to have you. Can you just take the platform? And
thank you very much. Thank you very much, Chairperson. Ms. Daniels, I see you are on there. Can I ask you to please, she's our Director of Special Learning, and she has prepared a presentation. Ms. Daniels, can you please take over and present on our behalf? Thank you very much.
Thank you. I see that the host has disabled screen sharing, so if I could just get the rights to share.
Could we just enable the screening of the sharing of the screen, please, Chairperson?
Lubabalo, can you assist, please?
No, Data, is there anything that you can do to help?
Yes, Chairperson. Is Director Berenice
Daniels? Yes.
I've already made co-host Honorable MEC.
Thank you very much.
If maybe she's struggling, she can quickly send the presentation to myself. I don't mind. Oh, perfect.
Ah, there we go. Okay, thanks a lot.
Okay, can I just check if my presentation is visible?
Yes, ma'am, we can hear you and I can see the presentation. Yeah. You are audible.
Is my presentation visible?
Yes.
Yes, ma'am, it's visible, but we can't see you.
Okay. All right, I'll just start my video. You're able to see me now?
Not really, but it's okay.
Okay. All right, I have put my camera on.
If it's not disturbing you. Yeah, it's we expected to keep our cameras on when we make presentations and when we speak, actually, so that the public can see who they are talking to.
Okay. I put my camera on.
Oh yeah, that's okay. Now we can.
We're seeing.
Thanks. Okay, all right, I'll share my screen now too. Okay, are you able to see my presentation?
Yes.
Okay.
Yes, you can see it. Can you see your presentation?
And you can see me. Good afternoon, everyone. Berenice Daniels, Director of Inclusive and Specialized Education Support in the Western Cape Education Department, and I've been asked to do the presentation this afternoon. I'm starting with the HIV AIDS and TB Life Skills program. This program has come over to our directorate from Curriculum FET, and that is due to an increasing emphasis on care and support in the HIV Conditional Grant program. And I think it is well placed with us, as we are also responsible for psychosocial and health support and special schools. So it fits really well with us. Okay, so just to remind us all that HIV and AIDS is still a very serious situation in the world and in our country. So all of us need to know our status and get tested, and this is the message that we also send to our schools. The conditional grant framework prescribes that we spend 15% on training and development, 15% on co-curricular activities, 25% on care and support. And as I've said, that fits in very nicely with the functions of this directorate. Learning and teaching support material, and then we also have advocacy and social mobilization, monitoring and support 8%, management and administration 7%, and then support for COVID-19 prevention and management to be integrated in existing focal areas. So our original budget was 19,734,000. The budget was reduced to 15,076,000. Our expenditure for the financial year, we have 100% spent the HIV conditional grant funding. What were our challenges? Our challenges were access to schools during the COVID-19 period for after-school face-to-face training, or mask-to-mask, of course, programs, and ensuring that all learners abide by COVID-19 regulations when the training is done. But whenever possible, we move training to virtual platforms, but with virtual platforms, limited internet connectivity was often a challenge. Another challenge which we have is recruitment of care and support assistants, a challenge due to these being contract positions. One understands that it is to give more opportunity to young people, but it does lead to many of them leaving as soon as they can find more permanent employment. Our achievements, we count as our achievement the World AIDS and World TB events, which are held in collaboration each year with the Department of Health, the appointment of 160 care and support assistants, the appointment of 8 social auxiliary workers, the fact that we have in a very short space of time migrated to online training, and the rendering of psychosocial support in our high-risk schools, and having that on-site support in the high-risk schools. And then, of course, the addition in 2020-2021, the COVID-19 prevention training. A lot of our focus has been on the training of these care and support assistants, particularly in the last year as we've been affected by COVID-19. So we train them on the HIV guidelines and reporting tools. The social workers have trained them on the Abuse No More protocol document. We have training by an NGO on basic counseling skills. They are also trained on learner attendance, because one of their responsibilities is also to check on those learners who are not attending school. So they've been trained on CMIS, peer-to-peer education training by, once again, an NGO, community school workplace upliftment activities and training by an NGO, sexuality, sexual abuse and life skills training, that is in-house alcohol and drug abuse prevention training, and anger management training. So when they come to us, they are quite inexperienced, and we guide them as they become more familiar with all of these skills and techniques. And we also have, in every circuit, we have a school social worker, and these care and support assistants are under the wing of the care and support assistant. It's very important that they know when something is out of their range, when it is beyond them to continue with the engagement with the learner. And so we have a support pathway, and as I say, each one of them is supported by one of the school social workers. Moving on to capacity building regarding HIV policy. The HIV policy training, we spread that over 2 years for the 1,600 schools, 800 trained in year 1. Virtual training was provided. The target group, principals, members of the school governing bodies, school management teams, and representative council of learners. Schools were given a chance to rewrite their own HIV AIDS policy according to the new DBE national policy on HIV, STIs, and TB. And then we also have trained the school management teams on evaluating on how successful they are in accommodating HIV AIDS learners in schools. First aid training is ongoing, 400 per year, and we do top-up training of the target group in all schools. The last group of teachers to be trained in the scripted lesson plan, so the ones in the senior phase, and the other phases we've already rolled out. Virtual training was provided. Training of learners has been on teenage pregnancy prevention, substance abuse prevention, positive behavior programs for boys, and once again, virtual training was provided. The COVID-19 training, we have made sure that all of the schools receive this training, and there you can see the training encompasses the basic understanding of the requirements and legislation, the Disaster Management Act regulations, the COVID-19 occupational health and safety measures, the directions, the measures to prevent and combat the spread of COVID, the Occupational Injuries and Diseases Act, guidelines for quarantine and isolation in relation to COVID-19 exposure and infection, practical training on the implementation of COVID-19 mitigation measures with an emphasis of schools. We are extremely grateful for the financial support that is being provided for this training, which is sorely needed in the schools. And once again, we just want to emphasize how important it is to know your HIV status. Here you see one of our mobile facilities for free confidential HIV testing and screening for TB and sexually transmitted infections. We were asked in the briefing to be brief, so we've been brief with regards to this. And then if I can move on to talking about the education conditional grant expenditure on the Lspid grant. Our provincial program manager is Heidi Meiberg. So this all started with a court order on Lspid. The government of the Republic of South Africa was the first respondent, but the government of the province of the Western Cape was the second respondent. The judgment was on the 11th of November 2010, and as a province we were given a year in which to respond, and we responded by November 2011. This was just the judgment. I think you're all familiar with it. The Western Cape Forum for Intellectual Disability was the applicant, and as you see there, the first and the second respondents. So the other province weren't specifically mentioned in the court order, but that would be encompassed by the first respondent. We had to, in a very short space of time, put together a plan for supporting the special care centres. The order indicated that children with profound and severe intellectual disabilities needed to have access to basic education, protection from neglect and degradation, equality and human dignity. So what was our response? It was an intergovernmental response because the order was against government and not just the education department. The Western Cape government affidavit was presented in November 2011. Provincial social development, health, education, public works and transport departments, as well as municipalities, provided an intersectoral response. We set up regular intersectoral meetings, and those intersectoral forum meetings are still continuing. On a quarterly basis, we also have meetings with the Western Cape Forum for Intellectual Disability. And I'll say more about that shortly. What was our response at the time? We committed to learning program development, training and capacity building, quality assurance of curriculum delivery, implementing a care and support for teaching and learning strategy, appropriate referrals and placement of learners, and last but certainly not least, multidisciplinary Lspid teams based at special schools to support Lspid and special care centres. Just to pause on that last point there, in 2008, with the ring-fenced funding for inclusive education that we got from National Treasury, we had created 20 outreach teams at our special schools who provided support to other special schools as well as to ordinary schools. And so when we were asked to support special care centers, we used the model of the multidisciplinary teams based at the special schools. And also because we were not sure on the national government response, whether the special care centers would become satellites perhaps of special schools, and then there'd be continuity in the support. And as from 2018-2019, we were pleased to receive funding from the National Conditional Grant. And as you will know, the grant purpose is to provide support, resources, and equipment to identify care centers and selected schools for the provision of education to children with severe to profound intellectual disabilities. And I'll say a bit more about the children that have been placed in schools so far. The grant is a Schedule 5 grant, and the purpose to provide the support, resources, and equipment to identify care centers in schools for the provision of education to learners with severe to profound intellectual disabilities. The fact that it is a Schedule 5 grant, of course, places restrictions on what it may be spent on. So in our discussions with the Western Cape Forum for Intellectual Disabilities, they have asked us why we cannot spend money directly on the special care centers. But as you know, the grant conditions are quite stringent. So we have, last year when we were given the opportunity to do so by Provincial Treasury, we did make a recommendation that because we are now implementing the support for 10 years, whether it would not be a consideration that the grants be a Schedule 4. But I think there are also complications with that. So the 5 outputs of the conditional grant: human resources, management of the database of the learners, the caregiving staff, and the special care centers, training, outreach services, and more recently, the response to COVID-19. These are the outputs of the conditional grant: 1 provincial program manager and 30 transversal itinerant outreach team members, 6 teams. We started out with 1 in 2011. In 2012, we increased that to 4. And then when we got the conditional grant funding in 2018, we could increase to 6 teams. We have 8 districts, and so the teams have to work across districts. Ideally, we would like 8 teams so that the teams could be fully integrated at district level. The database needs to be updated and managed. And then, of course, we need to do training of the outreach team members, the caregivers. But what is really encouraging now, we are preparing the system for Lspid, and so we've been doing a lot of training with our teachers. We started with our learning support teachers and our teachers at special schools for SID. Also, we're training in-service therapists and officials. In last year, we trained all of the inclusive and specialized education support staff at our district offices on the learning program for learners with profound intellectual disabilities and the other programs that support learning and teaching. And we do it in the context of the 3-stream model, which has the 3 different streams: your academic, grade R to 12, and then your technical, occupational, up to grade 12, but with the technical subjects. And then in the occupational stream, this is one of the programs, the learning programs for learners with PID. There's also the curriculum for SID and the occupational curriculum for learners in School of Skills. So we think it's quite important that teachers know that we are implementing a three-stream model of education in this country, and that the learning program is part of the third stream, the occupational stream. We planned outreach services to 2,000 learners in 75 care centres. A lot of the care centres have closed, and so we have fewer than 75, and I'll get to that slide in a few minutes. And then in selected schools, we've included cognitive assessment, psychosocial and therapeutic support, monitoring and support of the learning program for learners with PID. And you may know that there are schedules for the learning program now, and on a quarterly basis, much like what happens in public schools, there are assessments and reports. And then, of course, the response to the COVID-19 pandemic. Where are our transversal outreach teams in the Western Cape? We have 3 metro teams, and you can see the areas where they work, and 3 rural teams. Our budget allocation, the approved business plan allocation you see on the top, 28,499, and the division into compensation of employees, training, administration, and learning and teaching support material. And then once the deviation was approved, we also trimmed from each of the categories in order to provide 15% as a response to COVID-19. We had to estimate how much money would be needed for the response to COVID-19. We actually spent less than 15%, but I'll come to that in a later slide. I just want to assure everybody that PPE was provided to all the staff that required it, and for the learners as well. But we spent less than we planned, but I'll explain that in a moment. So the allocation was originally 28,499,000, but the total transferred was 20,520,000. And you have heard about this in the DBE presentation, as well as in the National Treasury presentation, that the last tranche payment was withheld. We spent 104% of the transferred allocation, but the percentage according to the total allocation was 75%. So just to go back, I said I'd go back to the response to COVID-19. Early on, already during hard lockdown, we started in the province thinking about how we could supplement the usual PPE, which was given to ordinary schools, for our special schools. Special schools have therapists, nurses, etc., and they would need additional PPE. This was before allocations were made, so we just made inquiries and discovered that it would be more cost effective to provide reusable PPE, for example, the all-in-one suits, rather than disposable suits. So when it came to procuring for the special care centres, we did the same as we did for the special schools, and the cost was much lower than what we predicted. We thought that the reusable PPE was a good idea, because at the time we were told that there was a shortage of the disposable PPE for the frontline health workers, and that as far as possible, we should reserve that for them. But I suppose it's also more environmentally friendly to where possible, use reusable PPE. So that is what we've done, and it cut down considerably on our cost for PPE in the province for our special schools, but then also for our special care centers. Because I think some of you might have wondered about that when you heard yesterday that we hadn't spent what we planned to on COVID-19 PPE. So our challenges and our proposed interventions for under expenditure. Our challenge is spending on COE or human resources. In the province, up till now, there have been lower post levels of team members, leading to under expenditure and withholding of the final tranche. How did that come about? Because we started with the outreach teams as from 2011, we appointed them at our special school resource centers who all have outreach functions, and we appointed them at the same level as our other 20 outreach teams. But with the grants being put in place in 2018, 2019, it was indicated that the teams should be on higher post levels and therefore higher salary levels. There was engagement by our human resources section with DBE Human Resource Section and Mr. Matthijs Kronier, the Chief Director for Strategic People Management. And the Director can say more about that. He is in the meeting. And we were not able to come to a resolve until this year. And he can explain to you what has been decided to go forward. So the proposed intervention, as you can see there, was that DBE and the Provincial Education Department had multiple engagements, and the outreach team members are to be appointed permanently according to the grant framework requirements and not according to the existing WCD outreach teams models. The process of appointing on higher post levels is in progress and should be finalized during the 2021-2022 financial year. Procurement. Due to the COVID-19 pandemic, all procurement processes were delayed from supply chain process to supplier delivery. The rollover request from 2019 was finalized in 2021-22. Provincial and national transversal contracts expired during 2020-21 and only awarded again in January of 2021. The Western Cape participation request for national transversal contracts could only start once the contracts were awarded again. All of the above processes were influenced by COVID-19 regulations. For example, all departments had to adhere to rotational attendance and closure of workspaces due to COVID-19 positive cases. Proposed interventions. Participation in national transversal contracts are currently in process, which would support provincial procurement via contracts. Procurement planning processes to be put in place accordingly to assist procurement, and the integrated procurement solution, IPS, making use of open tenders, which is a time-consuming process, will be minimized due to participation in national transversal contracts. Non-financial performance. So this is the disaggregated data of our 65 special care centers. There are 1,752 learners in the special care centers, and 28 of those learners have been placed in school so far this year. The learners with profound intellectual disability accessing the learning program, 1,117 in the special care centers, and we have also placed them in schools, the PID learners in schools. 28 of them are also accessing the learning program. In the early days, 2011, 2012, we looked at models for curriculum learning programs from all over the world. And in fact, one of the team members did a master's thesis on what was available in terms of learning programs. And so when a task team was established by DBE, some of our provincial Lspid team members, as well as our program manager, were on the task team that developed the learning program for profound intellectual disability. In terms of training, we've trained the 28 team members. There were 2 vacancies, which we are about to fill. We trained 307 caregivers, 199 teachers, and I've told you about them. They're in ordinary schools and special schools, 61 therapists, and then we also have trained the inclusive and specialized education support officials in the 8 districts, so that they are aware of the learning program. In response to COVID-19, all the special care centers received the PPE for learners, for caregivers and support staff. They received COVID-19 consumables and thermometers and all the relevant technology. Non-financial performance support services. Due to COVID-19, most centers were closed as of March 2020, and some only opened again in February of 2021, when the schools reopened for the school year. Support strategies, therefore, had to be adjusted from direct service to indirect support. We made use of virtual platforms such as WhatsApp groups with parents and carers, and they are the most amazing WhatsApp videos that were made. Therapists use their own children sometimes to demonstrate. There were also, use was also made of Facebook and Zoom were implemented to allow virtual support. Often parents were accessing this on the cell phones. Many of the parents do not have laptops or computers, but it was accessible on their cell phones. Home programs were developed with relevant learning support material, which the parents could collect at the center, or other means were made to get the home programs to the parents of the children. Parents gave very positive feedback on the home support, as for the first time, they were involved with specific activities developed according to their children's needs with relevant parent support instructions, video clips, and photos. So if there is a silver lining to COVID for special care centers and also special schools, is that parents, guardians, grandparents have become much more involved in support of these children. We've heard of a grandfather at one of our schools, grandfather of a child at one of our schools for cerebral palsy, who got so interested in doing the physiotherapy type exercises that he's continued to do that. So that has really been quite positive. Then, on a slightly negative note, staff members in the provincial office and outreach teams were off work for varying periods of time due to COVID-19 illness and resultant complications, which placed a strain on service delivery up to 3 months for some staff members. Then, in order for the special care centers to implement the learning program, or as we would also call it, the curriculum, we had to provide the relevant LTSM. So what did that include? Communication, gross motor, and fine motor toolkits to support the implementation of the learning program. Self-care toolkits, basic skills toolkits, administration toolkits. Classroom furniture was also provided because some of those children were not seated on suitable furniture. And as you know, particularly with children who have comorbidity of physical disability or cerebral palsy, that can lead to contractures. So it's very important that the children are seated appropriately. Assistive devices and therapeutic material and equipment. Then resources to support the different themes. For example, when they're doing the theme, me and my body, they would get resources to support that, me and my home, etc. So this slide gives you a broad overview of the West Cape Lspid support. I've spoken about most of it, but just on one slide. What is it that's happening for children with severe to profound intellectual disability in the special care centres? So at the moment, we are supporting 64 special care centres. There are 1,603 learners in those special care centres. There are 32 learners with profound intellectual disability who are accessing the learning program in schools. 545 caregivers in the special care centres are being supported. There are 973 learners with PID accessing the learning program. And to date, this is more updated than the previous slide because we're already into the first quarter of 2021, 44 learners placed in schools. We provide on-site support and remote support. We provided LTSM to the special care centres and the schools that have enrolled the Lspid. Therapeutic intervention is provided from physiotherapists, speech therapists, and occupational therapists. There's collaborative training with regard to the COVID-19 SOP with our sister departments. And we also monitor and support COVID-19 compliance. So we started off by talking about the court order and the first implementation period, which was started in 2011. And we started in the Western Cape with one team in 2011. By 2017, we had 4 Lspid outreach teams. And since the National Conditional Grant, there are 6 Lspid teams. So in a nutshell, the support to Lspid. There's a lot more that we would like to do. And we are looking forward to further discussions at the national level on what we could do in addition. I listened to the presentation from Mpumalanga, where they suggested that perhaps a function shift, much like ECD, could happen so that we have more direct management of the sector. So, and we also maybe look forward to an expansion of the conditional grant for learners with severe and profound intellectual disabilities. So this just gives you an indication of what the special care centres receive, and that is paid for from the grant. You see our therapists there packing the resources that go to these special care centres. You also see the assistive devices that are provided. I spoke about the need for proper seating earlier on, and being the left-hand side, you see a child who is seated so that he does not develop physical contractures, and he's seated so that he can focus on the lessons that are provided as part of the learning program. I think that is my last slide, and I could add to the information provided if need be. Thank you.
Thank you, Chairperson. If you would like to hear from Mr. Matthijs Cronje on the issue of the appointments, which I understand was raised yesterday, or otherwise that's the end of our presentation. Thank you very much.
I'm trying to open my camera now. Oh yeah, thanks. Thanks a lot for the presentation. Is there any addition to this presentation from your team?
Mr. Cronje, would you please just go through the process of the appointments that was raised as a concern yesterday? Are you there? Yes.
Chair, MEC, yes, I'm here. Just in terms of that matter that was raised with the underspending, specifically with regard to the outreach teams and the various levels, and I think that was also raised according to what I was informed. We sought some clarity from the Department of Basic Education on the conditions as reflected in the grant, because we had, it would have seemed to be somewhat in contradiction to existing legislation. We received feedback on that at the beginning of this year, the first quarter of this year, and then subsequently we started to put plans together, and also with the Department of Basic Education indicating how we're going to align to the levels that they've indicated. But there are also further engagements just to look at that legislative part, because it might have some future implications that we have brought to their attention. And as I indicated, we are engaging on that on an ongoing basis in order to get a resolve. But the levels will now be aligned, and we are making the necessary arrangements to get those individuals in a permanent capacity, as well as against the levels that's indicated in the conditional grant. So thank you, Chair.
Thank you, Chairperson. Then that is all from us, unless there are questions. Thank you.
Thanks a lot. I'd like to know how long, MEC, how long did it take you to make this lengthy report? Very interesting report.
I can't take credit, Chairperson. I'm not going to be a politician who takes credit for others' work. Ms. Daniels she was the one who put together the report. I'll let her answer if I may.
How long did it take?
Ms. Daniels, how long did it take you?
The provincial program manager for HIV is Mr. Frederick Mitchell. He put together the HIV report. Ms. Heidi Myberg, the conditional grant manager for Lspid, put together the report, which was submitted, and we were also in a meeting on Tuesday with DBE where some contraction of the report, was requested so that we do not present for too long, and I hope it was not too long. We did cut down quite a bit.
No, thanks a lot. The reason for my comment is that we are only interacting with this report that took you this long to prepare, to go into different divisions, direct of this and that, and then finally bringing the document together. How do you expect us to read this, to study this document and make our, informed interventions to help you? How do you expect us to do that if you're giving us the document in the meeting? I need an explanation. I think this committee is owed an explanation. Why did this kind of thing happen? Under normal circumstances, we're going to say no, that you should come and present some other time, some other day. This is seriously unfair, and it shows that actually people you don't really take this parliament seriously. Because if you did, you could have given us the document in time so that we interact with the document and also interact with you even before you come to the meeting. And this goes to at least others, even though they send their documents late, but we received them yesterday. Also, that doesn't augur very well, but you are the worst in terms of performance. Unless if I'm making a mistake that the documents were sent long time ago and maybe by some chance I never got a chance to see the documents. If that is the reason, let's get the reason, and then from there, or maybe let me just go into your presentation. Looking at the grant and its performance, particularly the reasons for the establishment of this grant on HIV AIDS awareness. Its purpose is to ensure that there is that we give people information, our pupils, our students get information. And that information should help them to change the way they do things. The impression I get is that with the rise in pregnancy, in teenage pregnancies in schools, you still need to give us statistics in terms of what is the situation in your province. That the teenage pregnancies actually reveals quite a lot. They tell us that either we are not talking the right language to these children, I mean, to the learners, and or people who are doing the intervention training are unable to reach these youngsters and let the training that they are giving and information that they give leading to, that it should lead to change in social behavior. The teenage pregnancy rates shows that we're not making that impact. And teenage pregnancies in schools brings lots of other questions, because pregnancy is a close contact thing. I was told stories when I was at school doing biblical studies, but that I think only happened those days. But for now, for teenagers to be pregnant, there should be physical contact. And in that physical contact, there are lots of things at stake. It could be AIDS, it could be TB, and COVID, because COVID also it's a close contact. It has something to do with contact of people in many instances. So, and I want to check, what is the load of your department, both departments? I think this goes for everybody, on the psychosocial support, that the psychosocial support at the school. What has been the impact of that on them? Because they are the ones who actually are affected when there are these kind of issues. Honorable members, I again want to check with yourselves as both departments, provinces, that what are our learnings from our neighbors, from the African continent as Africans. Uganda was at the bottom some years ago in terms of HIV impact, and didn't. Large numbers of people contacting the disease. But the government there took a decision and they came up with campaigns, the ABC campaign. And the reason being that once children are involved in this, in sexual activities, it becomes very difficult to move them from there to say they must now stop completely. But anyway, they'll just go ahead underground or whatever. But I think the other thing that can help us is to improve this thing, that those who are already active in this field need to stick with one partner to stem the spread of HIV and other sexually transmitted diseases, including also TB. Yeah, that's from me, honorable members. We have listened to the presentations, and I'm opening this for discussion and debates for the members. I guess the Western Cape is the last one to present. Is there another province that is outstanding?
Western Cape was the last province, Chairperson.
Yeah, Western Cape, I guess so. Yeah, we thought they were not going to be part of this. Honorable members, it's your turn. By showing of hands, I can see Honorable Ryder. Right on, and then there's Honorable Dudoit, Honorable Okam, Honorable Christians, Honorable Saziwa, in that order.
Thank you very much, Chairperson. I appreciate the invitation to comment. And yes, noting the number of colleagues that have their hands up, I'll keep it brief because I already had more than my fair share already. Then some overview comments. The Northern Cape and Northwest, those presentations are a little bit disappointing again, and not really seeing that we focused on the outcomes and focusing the spending on the people, the vulnerable people that need to be benefiting from this. And, you know, again, I spoke earlier on about whether we are spending money on things that are actually going to have a good outcome. And, you know, specifically, I'm going to pick on the Northern Cape and just say, you know, patting yourself on the back because you've delivered policy packs, you know, and seeing that as an outcome. I think that's not an outcome. That's the absolute basics. Delivering policy packs, letting people know what the policies are, you know, that's absolute. That's not an outcome. It's not something that should be measured. It's not something that's the absolute basic bare minimum that we possibly expect, is letting people know what the policy is. So, Chair, I'm just concerned about the outcomes and what we're measuring, and whether what we're doing here is actually getting the expenditure on the right people. I must say, Western Cape, yes, a big pity your presentation didn't get to us before, but I don't know if I missed it in any of the other presentations, but I really liked the home support aspect that has been introduced as a response. So something a little bit dynamic and thinking on the feet, and also some of the pictures that you included there for to let us know exactly what we're dealing with. Because yeah, I for one don't have a good understanding of in this space. But yeah, Chair, I'm going to leave it really at that. I think that the colleagues will handle most of the other issues. Thank you.
Honourable Chair, can I proceed?
Yes, Honourable Dudoit.
Thank you, Honourable Chair. Honourable Chair, I'll be brief. I want to ask the Northern Cape, when looking at all the other presentations that we received, and the special care centres that they mentioned, support was given to those care centres. Now the Northern Cape, in their presentation, stipulate that for one whole year, the care centres were closed, and they were not able to provide support, if I interpret it correctly. So what did the support staff that needs to tend to those special care centres do for the year? Other provinces indicated that, as Honourable Ryder mentioned just now, home support was given. I do not know what the scope of work of these employees are, if they can be applied in other positions. But out of the presentation, it seems as if there were quite a few employees that stayed home for a year, nothing happened, and we have a larger backlog than we had before COVID-19. Please provide more information on that. Thank you, Chair.
Honourable Okam.
Thank you, Honourable Chairperson. Honourable Chairperson, I have partially been covered by Honourable Ryder and Honourable De Tooy. One of the things that came out for me out of the presentation of the Northern Cape was that it seems that COVID has been used as an excuse for a lot of things not happening. Now, we all know that COVID obviously is with us and that we've got to work around it, but we all also know that there are certain services that from the beginning of COVID have not been prohibited. And we know that we can't force anyone to do something, even if they are allowed to do it. But I think that if you look at the statistics that's been given by the Northern Cape, it seems that COVID was an excuse that was used for a lot of actions not taking place in order to assist these learners with special needs. One of the questions that I've got is that with regards to the LSAs, the learner support agents that have been appointed. If you appoint quite a lot of learner support agents, it will obviously take up your budget, and you will sit here and you will present to us that your budget have been spent. My question is, how many of those LSAs have been appointed, firstly? And secondly, what has been put in place in order to monitor those LSAs? It is one thing to come and say, we appointed X amount of LSAs, but what did they do? What did you as a department do in order to make sure that they do their jobs and not only receive their stipend per month? So that is very important, what has been put in place to monitor them. Then a second question that I've got is that we saw that learners having therapeutical needs have not been attended to. So in other words, there must be a huge backlog on the needs of those learners, which have been lost due to the fact that nobody attended to them during this time. My question is, what is your department going to do in order to catch up on those backlogs that are there, in order to assist these learners? We cannot just accept the fact that nothing happened to them and we don't know what's going to happen with them now. Are they now getting assistance, firstly? And then what are your plans that's being put in place in order to make sure that these children and these people with special needs are being caught up on and they get the required therapeutical assistance that they need? Thank you so much.
Thank you, Honorable Christians.
Thank you very much.
Christians, yes.
Thank you, Chairperson. My first question is to the Northern Cape as well. Now, during the presentation yesterday, we heard, they told us a little bit about the current financial year reporting, something which very disappointingly the Northern Cape did not mention once in their presentation. We heard nothing about the current year financial reporting. So my question is, yesterday they reported that only 47% was spent so far for the current year on LPID. So I want to know by the Northern Cape Department, what are the reasons for this? What are the plans to ensure that targets are met in this year? And what are the areas of the underspending? If there are challenges with regarding to this low expenditure to date, what are the interventions in terms of this financial year's expenditure? And then also another thing the Northern Cape Department did not mention, which I think we all would have liked to have heard, is how many special care centers are there in Kimberley? How many of them are currently up and running? Are they capacitated? And were they assisted throughout the pandemic? And are they currently being assisted adequately? I would also like to know about the teenage pregnancies with regard to the HIV and AIDS grant expenditure. How many teenage pregnancies were reported to the department this year? And are these learners currently being assisted, especially matriculant students? Another disappointing trend in the Northern Cape is the training of officials and in-service therapists. I see that during the previous financial year, officials trained, 40 were targeted, 0 achieved. In-service therapists, 25 targeted, 0 achieved. Surely this training, to a large extent, could have been done online. I would like to know what are the plans for this year. All that was mentioned is that these people were going to be targeted this year again. How are they going to be targeted? When will this training take place? Could we have an update on that? Another disappointing target the Northern Cape mentioned was the provision of assistive devices. They said that 40 were procured in the previous financial year. In the previous financial year, 40 were procured. Now, the speaker mentioned that these devices were received. Now, my question is, why at this late stage has these devices not being delivered yet? Thank you very much, Chairperson. Just a last comment from my side. I would like to comment that a lot of these provinces could knock on the door of the Western Cape, which I believe is doing extremely good work. Thank you very much, Chairperson.
Yeah, thanks, Honorable Christians. Honorable Saziwa, it's your turn.
Thank you, Honorable Chairperson. Good afternoon to you and my fellow honorable members, as well as our esteemed MECs and our support staff. I just want to start where you landed on, that most of the time, in terms of our rules, whenever the department is going to make a presentation, at least in our case as a province, at least that presentation must be with members 48 hours before we have that meeting, so that we can thoroughly look at the presentations. And that is what's called positive engagement. And I want us as members to refuse to be made failures by rubber stamping reports that have not complied with how they're supposed to be presented for members to prepare themselves. I hear the member that has just ended on praising the Western Cape, but the Western Cape is one of those provinces that has just made the presentation in our meeting, making it difficult for us to properly apply our minds on the report that was just been presented before us. I think we need to be strong, and we need to condemn that kind of a practice, because it makes a mockery of oversight work that we're supposed to do as members of the legislature's chair. That's the first thing that I think is important for us to take note of. The second thing that I want us to take note of is the fact that I know that almost all provinces are indicating the challenge of COVID so far as the expenditure is concerned. But I think let's go back a little bit and remind ourselves that the president declared, the first lockdown on the 23rd of March 2020 to be effectively starting place on the 26th of March, which was only few days before the end of the financial year. Therefore, it's important that as much as we can accept some of the reasons that are excuses, in my view, that are elevated as reasons, that at the back of our minds, we must be aware that when was this lockdown declaration made? Which therefore means there was some kind of laxity on some of the provinces in terms of the implementation of those grants that are so crucially needed by poor children of our nation. Just on Northwest Chair, because I'll confine a few questions on Northwest presentation. Of course, having appreciated the other presentations made, that I think as the HOT has indicated that a grammatical error in terms of their reflection on the first grant, an IPCLD grant, that the December 2020 was referred as 2021. She has corrected the one of January to be March. So just that, take note of that needs to be corrected. That it can't be December 2021, yet we are in August 2021. So I think it's an error there that they've made in their presentation. The second issue that I want to indicate is that when they reflect that the original budget was 60 million rands, cut down to 12 million rands. But in terms of what they say are revised percentage, those percentages are the same as the ones that were there when the target, when the amount, or when the grant was still at 16 million rands. So they must clarify that. Why are they saying now this revised percentage has been done? Because if you look at their presentation, it's 20%, it's 8%, it's the same. Can they clarify that? The last issue that I want to check is that on the achievements that they are indicating, they are only giving us what they have achieved. But when they looked at their presentation, they did not indicate what was their target, so that we can be able to trace whether the achievement they've overachieved or underachieved. Thank you, Chair.
Thanks, Honorable Zaziwa. Is there another hand, any other hand, any member wants to? Yeah, as you respond, I was just checking if I've left one of the members out. When you respond, both provinces, just give us the statistics in terms of teenage pregnancy in your institutions. Some of the issues I've raised earlier, and then you could respond to them, and other members who have raised issues. And yeah, I must say I thought the members will comment on documents that are brought late to the meeting, but it doesn't seem to be a worry to most of the members in this meeting, those who spoke anyway. Over to you. We're starting with anyone who wants to respond. Whoever takes the baton first will be okay.
Chairperson, may I say something on the report?
Who's there?
MEC. Western Cape.
Oh, the MEC. Yes, you're welcome.
Thank you very much, Chairperson. We certainly don't take this report, this committee lightly at all. We regard it extremely seriously. I've been making inquiries during the course of the meeting as to what happened to the report. I understand we did submit one last week, but after there was a meeting, I think on Tuesday, between yourselves and our officials, there was an effort to shorten the report, and I am advised that it was sent through yesterday. So I think we need to find out what exactly happened there, and I will certainly take it up with my HOD also, but I understand it has been sent. So there's certainly no intention to disrespect, and I think we need to just sort this out. But thank you very much for the engagement. I don't have statistics on teenage pregnancies, but I would like to ask Ms. Daniels perhaps if she maybe does. Thank you very much.
Thanks, MEC and Chairperson. Could I give you the statistics for the past year? So may I go ahead? Chairperson, so should I mention our figures? We had 547 cases across 8 district offices for the past year. How we dealt with it? Our social work components provided psychosocial support to those learners, and in order to ensure that they return to school after delivery of the baby. So that is after the fact. But in terms of proactive preventative programs, both our HIV Conditional grant program provides pregnancy prevention, as well as our social work component. And we have seen a drop in certain areas where there were very high levels of pregnancy. Obviously, one is too many. So yeah, we will continue with those programs. We have heard from our districts that the situation has been aggravated during the lockdown.
So there are no statistics in terms of figures, numbers.
I have the statistics for the past year, and I will find out how that compares to previous years.
What were the statistics in the last year?
547 cases.
Okay. Okay, we continue.
Honorable Chairperson.
Yes.
From the Northern Cape. Chairperson, we certainly taking note of some of the concerns that have been raised. I must also say that in terms of the comments from Honorable Ryder, no, I don't. I wouldn't want us to use COVID as an excuse. I may just want to say, comparatively speaking to the other provinces, our allocation is severely less than most of our other colleagues. But then, in as far as the questions are concerned, I think what I may also just want to note is in terms of the terms of reference, we were requested to report on the 2021 financial year. So we did not report on the first quarter of 21-22. But obviously, if information is needed, then we can also just supply that information to members via a written reply, if that is accepted. In terms of the LSAs, we did report that we have 40, and there was a question in terms of how we monitor them. I think we all understand that they have to render support to vulnerable learners, and that they actually do refer our learners to various other centers that can assist them. They do have to submit monthly reports. There are school visits from the department provincially as well as nationally, and there is a reporting tool on the basis of which they have to report. In as far as home-based support, we have been providing home-based support. We have adapted lessons and materials which have been delivered to the center caregivers, and parents were also given orientation in terms of the support, and our officials have also been giving support. So in as far as the outcomes are concerned, we take note of the members' comment that as far as he's concerned, the outcomes are disappointing, and we would certainly want to see the extent to which we can upgrade our outcomes. But in terms of what was targeted, for example, in terms of the assessments, 79 out of the 113 learners which we have targeted have been issued with report cards following the baseline assessment and learning activities. So all of those was done. And then in as far as training is concerned, some of the things that we are going to do, yes, we have planned face-to-face training for caregivers and officials, as well as in-service therapists. But of course, our numbers had to be reduced in line with what is allowed in terms of the numbers in terms of the COVID protocols. So caregivers and teachers are as implementing staff, they have been prioritized for training. And then our officials and in-service therapists, although they've been targeted, they do not work in the special care services. So in the special care centers. So what we will do in terms of the other questions regarding Honorable Christians, what we can do also, Honorable Chair, is to compile a written response in terms of teenage pregnancies and all of that. And then we have taken note of all of the questions, and then we will respond to that in writing, Chair. If the ideal period is 7 days, then we will respond to those questions in 7 days, without taking up too much time now. Thank you, Chairperson.
Thank you, Chair. From the Northwest, in terms of the psychosocial support to the learners at risk, we do have school health programs that we are running together with the Department of Health and the Department of Social Development. As I've said, these health programs are targeting all learners at risk. And the information on pregnancy in schools, Chairperson, I do have the statistics for 2019 and 2020. For 2021, I do have information for only 2 districts, and therefore I request that Chair allow us to consolidate the information, and we send it to the Secretariat for the Select Committee. But for 2019, we had 1,025 learners who fell pregnant across the 4 districts, and for 2020, we had 952 learners that fell pregnant. These learners were also targeted, and they were provided with psychosocial support and encouraged also to come back to school after they have delivered. And the most affected area, as it happened, is the area in Nakamudiri Mulema, which is Ratlong, and special programs.
You are muted, ma'am.
Oh, regarding, am I okay now, Chair?
Yeah, you were muted. Thank you.
So, should I start from the beginning? Okay. Chair, regarding the question of the revised percentages as far as HIV and AIDS grant is concerned, I think it is slide 1.2. Yes, the budget for this grant was cut from 16.7 million to 12.7 million. However, in terms of the percentages per item, we did not revise the percentages. The percentages are the same because for the initial budget allocation, for example, for advocacy, we had allocated 20% of the 3.3 million. But after the revised budget allocation, which then advocacy was now 2.5 million, this was 20% of 12.7 million. That's where the difference is. The percentages are the same. But for the initial budget allocation, we were using 16.7 million, and for the revised budget allocation, it was 12.7 million. So those percentages were the same. The only annual allocations are the only differences there. And the achievements versus the target for the financial year 2020 and 2021. I think, Chair, if I have to go through all these achievements now with their targets, may I request that we compile that information again, or we revisit the slides and put them accordingly in terms of the key result areas, the targets, as well as the achievements per key focus area. So if Chair allows us, we will send this information to the Secretariat within 7 days from here onwards. So Chair, I think that will be all from the Northwest. Thank you, Chair.
You are muted. You are muted, Co-Chair.
Sorry, excuse me. Now, I was just saying that the impact of our interventions, for me, are disputed by the increase in the number of teenage pregnancies at school is because we're not talking the right language, or our message is not being very helpful. But anyway, it's okay. Is there any other additions from the members? If members want to say something, comment.
Chair, my hand has been up.
Oh, okay. Yes, the floor is yours.
I've been back for some time, Chair. My name is Paulie Bushielo.
Yes, Honorable Bushielo.
Yes, I'm just saying I've been back for a while. In Limpopo, in terms of the number of pregnancies up to December, it's 767. And we have asked the MEC for health when you raised the issue yesterday, that she must compile us an accurate report from March last year, maybe to now in end of July, so that we are able to see whether the pregnancy issue has been also impacted by COVID-19. I'm saying this because remember, learners use, or we use differentiated timetabling, and sometimes they come to school twice in a week, and then the rest of the week we might not know what is happening. I have noticed also the number of rapes of little children going up in our province, and I've asked our district to be on the outlook, and we're working together with Department of Social Development. Yesterday, I got a very disturbing report that a grade 9 learner have died, committed suicide in Mankweng because she's pregnant and her parents are very, very strict. So I agree with you, Chair, that maybe we might also want to change the way we are advocating and be able to reach out for the learners. The other thing I think we are not doing very well is that most of our learners now are techno-savvy. If you want to get them, you get them on social media and other platforms. And we still want to use the old method, which they are not there. Maybe we might want to also look, because the grant for sure would allow us to look at the issue of social media and use it to reach out for them, because that's where you can be able to know what they're thinking and also intervene when there is a need. Thank you very much, Chair.
Thanks. Is there any additions from other members who would like to? The question of the media, our campaigns, our strategies also need to be reviewed. I think so. Like I remember some years ago, there was an organization, I don't know if it's still there, Planned Parenthood South Africa. I had a friend who worked there, and over some years they did a survey to check why were their facilities not used in other areas. And the reason was that the nurses that they have at the hospital, at the centers, the field workers were very old people. They're actually grandmothers. And when children come in, like teenagers come in for prevention, the remarks will be, "Oh, are you already active at this age, my granddaughter?" And then, then they stopped going there. It's those little things that we need to, to be aware of when we do our programs. Thank you. Honourable members, are there members who still want to take a bite, ask questions, engage? Okay. In the absence of further questions, Chairperson, Co-Chair?
Yes, Chair.
Do you want to close the meeting? Just close the meeting, and so that we...
Yeah, okay, Chairperson, I went out for a bit. I just want to check if FFC, PBO, and the Treasury commented on the deliberations.
Sorry, I thought they were not in the meeting. I'm very sorry.
If they are, please, I humbly request that you give them an opportunity.
Yeah. Is the FFC in the meeting? Treasury, PBO?
I'm still in the meeting,
thank you.
Chairperson from the PBO.
Yeah, thanks for... Sorry, I barely closed the meeting without talking to very important people who are looking after our pairs also and monitoring how the pairs work, what's happening in the pairs. Over to you.
Thank you, Chairperson, and thank you, Honourable Mshango. Yes, this was actually a very interesting workshop, and it was a very, very useful exercise. And we actually realize now that how complex the management of conditional grants actually is, because it's not just about receiving money, producing outputs, and that's the end of the story. It actually starts with the schedules to the Division of Revenue Act already, and then departments must go back. They must develop business plans. They must instate systems and processes to report. So it is really a complex situation, and therefore, I really think some of these processes should be refined, or it could be refined to make it easier on the administration of departments and provincial departments as well. But for our purpose, I actually would suggest that between the National Treasury and the National Department of Basic Education, that they publish some of these informations. We as the PBO would love to have access to the business plans, for example, and we would also have would like to have access to quarterly performance reports. We do have access to the expenditure reports, but we don't have access to any performance reporting on a quarterly basis. And without that information, there's no ways that we can assist our members in Parliament with an independent analysis. Yes, that is basically what I wanted to say. And thank you very much for such a comprehensive workshop over the past 2 days. Thank you.
You are more than welcome. We really value your presence in this meeting and the changes that will help us to bring in. Who else is there? Is it Treasury? Is the Treasury still in?
Yes, Chairperson.
Mr. Pillay, sir.
Yes. Can I go ahead?
Yes.
Okay, thank you, Chairperson. So yeah, I think first of all, it was interesting hearing because we had 2 grants, one well established, close to 20 years in the system, the HIV and AIDS, and one relatively new. But COVID issues aside, there still seems to be issues that cut across in terms of these grants. I mean, it's an old grant with HIV and AIDS, for example. We'd have expected that implementation challenge should have long been resolved, but they seem to persist, as with the new grant with the Learners with Profound and Intellectual Disabilities Grant. And one of them being, for example, the LTSM and the procurement issues, buying LTSM and not actually delivering it to schools. That's one of the issues that we picked up. Just some issues in terms of underspending for the current year. So last year was an extraordinary year, but in the current year, I picked up that there are some projected underspending because of, for example, appointments were not able to be made, and compensation of employees is a special category because it does not allow funds to be rolled over to the next financial year. So there is provision in the framework, and I suggest that the National Department, together with provinces, look at how they can rework the components within the business plan and amend it, because there is a provision in the frameworks that allow for that. But there is a cutoff date. I think it's 19th of November, so it needs to be done before that, so that the provinces don't lose funds unnecessarily. Mpumalanga raised an issue about rollovers, and they were not sure whether it was approved. The provisional rollover process was actually concluded in June already. So we did communicate to the provincial treasury. It just might be an issue of communication, but we did send through provisional approvals for that. Yeah, the one issue in the Lspid grant was the issue of funds being withheld, and it wasn't to one or two. It was actually to quite a few provinces. and funds are withheld on two grounds. Either it's poor spending or non-compliance with the Act and the framework. So there were various instances of non-compliance. So we also urge the provincial departments to please comply with the frameworks. Simple things like reporting should actually be done on time, and that can be grounds for funds to be withheld there. So please adhere to the conditions of the framework. As we indicated yesterday, we are prepared to assist, especially when it comes to compliance issues with frameworks, in providing guidance to provinces or even the national department if the assistance is needed. I think the last one, the issue raised by the MEC in Limpopo about flexibility on the conditional grants and the frameworks. Just to say that the framework is actually a process that takes place each year as part of the Division of Revenue process, Division of Revenue Bill process, and it's going to start soon for the next financial year, where we're going to send out draft frameworks to all national departments, and they will have to consult with the provincial departments in their sectoral forums and decide if they think a particular condition is too restrictive. They need to say so, and they need to propose an alternative to it. And this will obviously come back to us at National Treasury when we review it before the final framework is due on the first week of December. Right. From our perspective, what we check in the framework, remember this is the national department's or the sector's framework. It's not the National Treasury's framework, because you know the business better than us in terms of the education outcomes. But what we check for is the framework complying with regulations, the PFMA, the Division of Revenue Act. We check for that. We check that the conditions are not imposing an undue burden on provincial departments or any other reporting agents. And we also check that the conditions are reasonable and they are enforceable. It's pointless having conditions that you're not able to enforce there. So this is the entire process. And as I said, if the department feels that the conditions need to be looked at, they need to discuss it in the sectoral forums and then bring it to National Treasury, and we can take it forward. Thank you, Chair.
Chairperson, FFC.
FFC.
Thank you, Chairperson. Sasha Peters from FFC. I think for us, it's just to say thank you for including us in these deliberations of the past 2 days. It's good to get input from practitioners and to understand what's happening on the ground. And I think now just to move forward, it's to use the information gathered over the past 2 days and to work out how we're going to iron out some of these implementation challenges. And these are challenges which, as we've heard and from our analysis that we've done here at the FFC, have been characterized. I think as we move forward, from our side, we'd suggest being clear on what steps will be taken to turn around some of these challenges, and also to set reasonable timelines as to when some of these challenges will be addressed. So thank you again for allowing us to be part of the deliberations. Thank you, Chair.
Thanks, FFC. Who's next? Is it Treasury? No, we have Treasury, Mr. Pillay. Co-Chair.
The DM, Chair.
Co-Chair, before I give you to close the mic to close the meeting, let me give the minister, the deputy minister, to give us closing remarks. Over to DM.
Thank you, Chair. Thank you so much.
And thanks for being here. You're always with us. Thanks.
Yeah, we've just concluded the elections of the Speaker. Now we have a newly elected Speaker of the House, Umam Nosiviwe Mapisa Nqakula. So we want to thank you, Chairperson.
Malibongwe, TM.
Malibongwe.
Malibongwe Kamalama Kuskas.
Thank you. Yeah, let me take this opportunity to thank both select committees on appropriation as well as education, technology, sports, arts, and culture. You have created this platform for accountability. Yes, but to me, it's more than accountability because we are sharing experiences. We have given provinces, which we don't normally give them, to share experiences. And even if some MECs did not attend, which is highly regrettable, but the officials, because they were here, the CFOs from all provinces, they were part of this meeting, they shared best practices, which means in the next meeting of this nature, our report will be much, much, much better. And the presence of the Treasury, presence of the FFC, it boosted a lot in the morale of the sector as a whole. So want to also appreciate and thank MEC of Finance in KZN, Umamno Musa Dube. Chair, I know you'll do it, but I felt that I must do it because she has been consistent in this meeting. And want to thank you, our leader, and you lead by example. And we have been in this meeting since yesterday and today. Since I joined, I've been looking and I saw that you are in the meeting. Chair, we want to thank the attendance also by officials across basic education sector, national and provincial treasuries, as well as the FFC, as I indicated earlier on. The committee raised concerns about the late submission of presentations, which is regrettable, of course. And we make it to be very difficult for the committee to do their work if we don't submit the presentations on time. But we appreciate the explanation by Western Cape MEC, because it was Western Cape that was highly, which was a concern raised by Western Cape. But MEC Schaefer, I think, did, of course, explain, and we really appreciate. Chair, the basic education sector appreciates the platform on two reasons. Number one, provinces learn from each other on measures to improve spending and also to deliver the services. And services for our learners, and also the platform was accountability on the sector as in one roof. We have noted the inputs made by the committee with regard to performance of the grant and the spending on the allocation and the allocated budget. We have noted concern raised and have committed to work together as a sector and assisted by national and provincial treasuries to improve on processes that are impeding optimum performance. As I conclude, Chair, the matter of Golden Step Special School in KwaZulu-Natal will be followed up. Would like to thank the Select Committee on Education, Technology, Sports, Art and Culture for its oversight to KZN, because it has assisted us to flag out some challenges that we may not have seen or may not have been aware as the sector. Yes, KZN did indicate the reasons being COVID-19, yes, but the Select Committee said for 8 years, then it tells that there is something that we did not do right. We are going to monitor that. We encourage meetings of this nature to take place every year as they serve as a propeller for delivery. The DBE and provincial education departments have learned from the wise counsel of these sessions and assure the members of the improved delivery in the next reporting. Chair, if I can say, yes, I don't want us to keep on giving credits to COVID-19, yet it did play some role, of course, but we don't want to hide behind COVID-19. But if we can look at the first quarter report on the two grants, there is a significant improvement, and it tells that we will be moving towards the right direction. And as the mother departments, though I know they are independent in their own right, provincial departments as per the constitution, but we are going to work together and monitor and encourage the CFO to work with the CFOs to monitor the spending on the grants, because these are not the only grants that we are monitoring, and all other grants we will monitor that the money is spent wisely on the purpose and the intention it has been proposed. We want to take this opportunity to sincerely thank the committee for affording us the opportunity to account to yourselves and the people of South Africa in general. Siyabonga kakhulu inkomo olibuwa ngamanda realeboga. Thank you, Chair.
You can say that, DM. Thanks a lot, DM. And there are other outstanding matters that we will engage with as we go on. We'll wait for the report. And of course, we are working on a report of our oversight visit, which some of the things I wish we could deal with them in this meeting, but they don't necessarily belong to this meeting, but they belong to us as this committee, including appropriation, because it deals with issues of our assessment of the damage as politicians in KwaZulu-Natal, and some of the things that we read in the papers that the bill will be more than whatever 100 of millions of rands. Yeah, but anyway, we'll deal with that when the time comes for us to present our report, the oversight report, including the other issues that are bordering on the line of corruption in some of the areas that we visited. I think they will emerge in our report those. Co-chair.
Thank you, Chairperson. Let me take this opportunity to firstly thank so much the cooperation and the presence, the commitment by the Deputy Minister of Basic Education. I think she's leading by example. In Bogoto, she's multitasking and she's not compromising any of her responsibilities. Sesni Speaker, because of your participation, Honorable DM, thank you for that work. As you have said, also Honorable Deputy Minister, I think it really was an important session. I'm agreeing with all those who are saying it was an important session, an exercise that needs to be done regularly. I'm also taking this opportunity to thank the MECs, the chairpersons of the portfolio committees, the committee members of both select committees, the HODs, the stakeholders, and all participants for being available for these 2 days and set aside other things and take these matters seriously. So as a committee, we want to thank you, and we say to the country that we can't just, as appropriation, we can't just allocate monies and walk away. I think we will understand the way we come from. We have to follow up and stronger in-year monitoring is very, very, very vital. Even with other oversight bodies, such as the provincial legislatures, we are just doing what is expected from us. The legislative pieces are, as the laws of this institution are giving us a mandate and are giving us a direction as to what to do. We need to ensure financial and performance accountability for the sake of our people who are poor and vulnerable. And hence, we felt that for those who were not here for whatever reason, except for the reasons that were explained to the two committees and participants and agreed to, we felt there's a sense of undermining the process. But I want to emphasize that it was very important because we want to improve the services that we are giving to the vulnerable and the poor. So we can address the treble challenges in our country. We all know that as a country we're facing the triple trajectory of inequality, unemployment, and poverty. And amongst that, I think it will not be triple again. We're facing this fight against COVID-19 and GBV. So we have a lot on our plate. I'm talking about GBV because Honorable MEC Bushielo has just shared sad news with us that we don't know. This might be because of this invisible enemy that has declared war against us. So the department themselves should put in place, I have said that this yesterday, that we expect you to have in your systems to put monitoring and evaluation systems. Hence, I've asked the question of internal and independent audit committees, so that you can quickly detect the red flags. So with those few words, I don't want to waste more of your time. I just want to appreciate your availability, your contributions, members, our support staff, everybody, stakeholders. And I want to close by saying, let's all stick to what we have committed in this meeting. I know that we have made recommendations, we have made resolutions, to a certain extent agreed on some recommendations and suggestions. So we will further engage. We still have, as appropriations, invite other sector departments where we see there are problems. Hopefully, we might not see you. You might not experience problems again. Next time when we meet, we might meet on other agendas. Thank you so much, everybody, and keep well. Please stay safe. Thank you, Chair.
Thank you, Chair.
Siyathokoza, Princess Mashangu. This meeting is adjourned. Thank you.
Thank you, colleagues. Bye.
Thank you.